gallstones, cholecystitis, followed by the rare disorder of malignancy or carcinoma. So first, what is bile? Bile is a digestive juice that is made by the liver. It is responsible for helping the body to digest fat and the fatty foods in our diet, because it helps in the absorption of fat soluble vitamins as well. Normally the bile is golden in color, and our body make about half to one part of bile each day. And what is a gallstone? Gallstones occurs when body's chemistry gets out of balance. The bile gets either too thick in the gallbladder and crystallized to form stones. Normally, the bile is the particular thickness of the bile is maintained by the interaction of the bile acids with the cholesterol, which is usually made soluble over here with the help of the bile acids, which have a component which is water soluble. They can be single or many, can be very greatly in size. The size is generally determined by the amount of the time that the stone have been present. Twice gallstone may resemble the gravel peas or even the olives. ठीक है, अगर ये क्वेश्चन हो कि गॉल ब्लैडर की जो स्टोन है उनका साइज क्या होता है, तो जो प्योर रेयरली जो प्योर गॉल जो कोलेस्ट्रॉल स्टोन्स होते हैं, they can be as big as that of the bird egg size, but they are usually the size of the peas, gravel or olives. So होता क्या है, they remain in the gallbladder for a long time. They get fragmented, they enlarge, press each other and get fragmented. That is why they can be as small as peas, as small as gravel, and as large as olives. So basically there are three types of the gallstones: pure cholesterol stones, mixed, in which the cholesterol is mixed with the other type of with the either the salts of calcium, etc. And then the pigmented stones, which composed of bilirubin, which composed of calcium bilirubinate. When we say pigmented stone, the pigmented stone themselves are of two types: black stones and brown stones. Black stones contain calcium bilirubinate, which is common with the cirrhosis and hemolysis, and brown stone, which usually develop after biliary tract infection. Okay, so I again explained that the types of gallstone depend on their composition. One are the pure किस पे बना हुआ है? One is the pure cholesterol stones, then is the mixed, in which the cholesterol is mixed with the calcium bilirubinate, and this is the predominant type. And then there are pigmented stones, and pigmented stones themselves are of two types: black and brown stones. The black stones have calcium bilirubinate, and it usually develop after hemolysis, and brown stones develop usually after biliary tract infections. So who are the people who gets gallstones? That is prevalence and risk factors. So it is basically 4Fs: female, fat, 40, and fertile. So basically, obesity has a role with the development of the gallstones. So those patients who are having NASH or who are obese are likely to develop gallstones. Then again, when the women are fertile, that is, there are more number of pregnancies. There are high level of estrogens, and when there are high level of estrogens, there is more chance to get gallstones. And the reason why hyperestrogenism, when the level of estrogens are high, the patient develop gallstone is that because the retention of the lipoproteins, the HMA-CoA activity in the liver increases, and once this activity of the enzyme increases, the body starts retaining more cholesterol, and when this more cholesterol reaches to the bile, the bile salts will not be available to make them absorbable, to make them soluble in the bile. So that is why they precipitate and make up stones. So vast majority of the stones are silent. Okay, 80% of the stone remains silent. So it is only 20% of the stone. It is only 20% figure when the patient have gallstone and they present with the symptoms. So prevalence and risk factors are the age and sex. which we have already discussed, that as the age increases around 40, and sex, it is common in females. The reason why it is common in the females are, as I said, hyperestrogenism. That is, whenever the level of estrogens are increased as a result of pregnancy, or if the female are taking oral contraceptives, whenever the level of estrogen are raised, there is increased chance of having gallstones. And why there is increased chance of having gallstone is that actually the lipoprotein retention by the increased activity of HME-CoA in the liver increases, and there is increased chance that the cholesterol will precipitate and make up stones. The environmental factors are again like obesity. Obesity will lead to the development of the gallstones, and then are the acquired factors. That the acquired factors are though if the patients with the hemolytic anemias, the patients with the hemolytic anemias, the patients with the different cholesterol retention disorders have more chance of having gallstones. Then are the hereditary factors. The hereditary factors are the enzymes which are responsible for the cholesterol excretion. If they are somehow affected, there is more cholesterol, or hyperlipidemic syndromes, when there is more cholesterol to the when the gallbladder has to excrete more cholesterol, there is increased chance to get gallstones. So if we come here, this is basically the elaboration of the same. Demographics. There are two types of gallstones: cholesterol stones and pigment stones. And if we look at here in the Western population, it is basically the cholesterol stone which is a problem. And we can well understood why in Western population there is more chance of having cholesterol stones, because of their dietary factors, because of their lifestyles. They have hyperlipidemias more. That is why they have more MIs. So when there is more cholesterol, basically the cholesterol stones develop when the chemistry of the bile get out of balance, because increased cholesterol is there for the bile to excrete it. And if the cholesterol is more and the bile salts are not present in the sufficient quantity to make them soluble in the bile, as a result they precipitate. So the cholesterol stones, the advancing age, female sex hormones. Okay, so why females, why there are 4Fs for the development of gallstone is female gender, oral contraceptives, and pregnancy. In all these there is hyperestrogenism. ठीक है, estrogen का level increase हो जाता है. जब भी estrogen का level increase होगा, there is more chance to get cholesterol stones. और इसका reason मैंने आपको बताया कि basically जो liver में enzyme होता है HMG कोई उसकी activity increase हो जाती है and body start retaining more cholesterol. Obesity and metabolic syndromes. ठीक है, metabolic syndromes कौन से हैं? जैसे hyperlipidemias है, या metabolic syndrome like we have talked about liver, about NASH, non-alcoholic steatohepatitis. इस तरह के जो syndromes हैं जिनमें cholesterol का level increase होता है, lipids का level increase होता है, patient will remain at the risk of developing gallstones. Rapid weight reduction. ठीक है, rapid weight reduction होगा तो क्या होगा? पहले body से जब एकदम बहुत सारा fat body का melt करेगा, उस फैट को कहीं से एक्सट्रीट होना है. फैट कहाँ से एक्सट्रीट होता है? थ्रू बाइल. अगेन जब बाइल में बाइल सॉल्ट्स का जो क्वांटिटी है वो तो सेम रहेगी, लेकिन अगर rapid weight reduction है, there is lot of cholesterol which go to the liver, to the bile for excretion. If it does not get excreted because there are less bile salt, what is going to happen? That it will precipitate. ऐसे ही होता है ना. बाइल सॉल्ट्स का फंक्शन क्या है? बाइल सॉल्ट्स का फंक्शन ये है कि जो water insoluble cholesterol है, it make it soluble by getting joining to it. लेकिन जब ये फंक्शन नहीं हो पाता तो what is going to happen? It will precipitate. ठीक है, वो वहाँ पर precipitate होगा. जब precipitate होगा तो दो तीन molecules जब when they combine with each other, they will start making bile salts. Then is the gallbladder stasis. Okay, when there is gallbladder stasis for any reason, either it is post-surgical, either it is obstruction, etc. Finally, what is going to happen? Again, the precipitation of cholesterol happens and it make it stones. Then inborn error of bile acid metabolism. Okay, inborn error of bile acid metabolism, you don't need to remember the name of the bile acid, sorry, the metabolic disorders, but what you need to understand कि bile acids का normal function क्या होता है? Bile acids का normal function ये होता है कि जो water insoluble cholesterol है, जो और constituents है bile acids, bile salts basically make it soluble. जो bile salts का fat soluble component होता है वो face करता है towards the cholesterol और water soluble component face करता है to the other side and it make it soluble. So when this normal function doesn't happen, like अगर bile acids का तो hereditary metabolic disorders है bile acids है ही कम, तो क्या होगा? cholesterol तो आएगा liver में to get excreted from the body, but that phenomena of the excretion doesn't happen, and what happens is that what is going to happen that it will precipitate. The same is happen in hyperlipidemia. हाइपरलिपिडीमिया में क्या होगा कि कोलेस्ट्रॉल का लेवल लिपिड्स का लेवल बॉडी में बहुत ज्यादा होगा. ईमिया का मतलब है कि क्या कि ब्लड में इसके लेवल्स बहुत ज्यादा होंगे. जब कोलेस्ट्रॉल के लेवल ब्लड में बहुत ज्यादा होंगे तो the more cholesterol will be available to the bile to get excreted, and if that phenomenon of excretion does not happen, what is going to happen? It will precipitate and make cholesterol stones. So if we count them, it is 1, 2, 3, 4, 5, 6, 7, 8, 8. There are 8, 9 causes. But if you understand that basically the reason behind it, it will help you in memorizing. Otherwise, you may get in problem. Then is a pigment stones. Pigment stones हमने क्या किए थे? Pigment stones themselves are of two types. One are the black stones and the other one are the brown stones. So it is more common in Asians than Westerns. Okay, here we see that the cholesterol stones are more common in the Western population. Chronic hemolytic anemias. Chronic hemolytic anemias में there is breakdown of the cells. When there is breakdown of the cells, more heme is available, and finally it will precipitate and form stones. Then there are the biliary infections like by the Ascaris, by the E. coli. It causes the formation of the pigment stones. Then the gastrointestinal disorders like Crohn's, ileal dissection, cystic the pancreatic insufficiency. These all disorders will also lead to the pigment stones. Now, while the cholesterol stones are more common in the US or Western population, the reason is very simple, because their dietary their living style, their dietary habits predispose them to the development of cholesterol stones. Okay? Just say for the MIs, for the heart-related issues, the hyperlipidemia, the hypercholesterolemia remains at the top, and it is more common in the Western population because of their lifestyle and because of their dietary issues. Then is the pigment stones. The pigment stones are more common in the non-Western population. The reason being that because the pigment stones are associated with infections, and infections are usually common in Asian countries, so that is why the more patients have pigment stones. Now, this is all about stones. Now, talking about the pathogenesis of acute cholecystitis. So the cholecystitis has strong association with the development of the gallstones. Usually, cholecystitis develop in the patients who have gallstones. So what happens that there is a blockage of the cystic duct. A cystic duct, if we simply view the anatomy, where does the cystic duct? It is gall fundus, body of the gallbladder, and then the cystic duct which takes secretions from the gallbladder to the for the purpose of excretion. So what happens that जब cystic duct की obstruction हो जाएगी तो जो सारा bile है, it will remain in the gallbladder. What happens when it remains in the gallbladder? There is chemical damage by the bile in combination with the damage by the gallstones. ठीक है, gallstones खुद क्या कर रहे थे कि gallstones कहाँ पे present हैं? They are present, they are in touch with the mucosa of the gallbladder. So अगर gallbladder की mucosa पे by nature it is empty and it has only a liquid component which is called bile. But in gallstones, the stones sit over there, and when they sit over there, they causes continuous rubbing, continuous erosion of that mucosa. So the chemical damage or the bile is a chemical solution. So there is a chemical damage and there is a physical damage by the gallbladder. So what happens? The mucosal phospholipases hydrolyzes the luminal lecithins to toxic lecithins, and they have a detergent action on the bile salts. And as a result of bile stasis, secondary infections also develop by E. coli, and as a result of all this process, the gallbladder become inflamed. So the pathogenesis of the cholesterol stones are four. By the gallstones develop. The pathogenesis of cholesterol stones is that there are four simultaneous conditions which lead to the development of hypercholesterolemia. One is the bile supersaturation. ठीक है, हमने डिस्कस किया था कि कोलेस्ट्रॉल के गॉलस्टोन्स में बेसिकली क्या होता है कि बाइल की सुपर सैचुरेशन होती है विद कोलेस्ट्रॉल. There is hypomotility of the gallbladder, which again promote to the nucleation. Then cholesterol nucleation in the bile is accelerated, and there is hypersecretion of mucus in the gallbladder that trap the nucleated crystals and lead it to the aggregation into stones. So if we look at over here, the this is bile salt, lecithin, and cholesterol. So if there is too much of the cholesterol, there is supersaturation. ठीक है, supersaturate हो जाएगा तो bile salts are not available to make it absorbable, and there is gallbladder hypomotility. So cholesterol nucleation occurs, and it forms these cholesterol monohydrate crystals. जैसे जैसे mucus की hypersecretion होगी, stasis increase हो जाएगा, and calcium salts become less and lead to the development of gallstones. So basically this is a repetition of the same which we have already discussed. This we can skip. इसमें सिर्फ ये क्या है कि कौन से bacteria which are more likely to produce leucokinase. It is most commonly it is E. coli and Enterococcus and Klebsiella. So pigmented stones में basically होता क्या है कि जो bacteria है which is most commonly E. coli, they secrete beta glucuronidase. When they secrete beta glucuronidase, what is going to happen? The more and more bilirubin combine with the calcium and form calcium bilirubinate, and it form pigment stones. ठीक है, अब जब पिगमेंट स्टोन्स होते जाते हैं तो ये स्टेसिस को प्रीडिस्पोज करता है और स्टेसिस पे मोर बैक्टीरियल प्रोडक्शन होता है. तो मैं क्विकली रिव्यू करती हूँ दोबारा कि दिस इज बेसिकली दिस schematic diagram is showing pathogenesis of cholesterol stones. Okay, cholesterol stones की पैथोजेनेसिस में जो अगर मुझे ये बताना हो आपको कि कोलेस्ट्रॉल की स्टोन की डेवलपमेंट में कौन सा एक फैक्टर इज मोर इम्पोर्टेंट इज कि लिपिड्स का और स्पेसिफिकली कोलेस्ट्रॉल का लेवल इंक्रीज हो गया एंड बाइल सॉल्ट्स आर नॉट अवेलेबल या एनफ बाइल सॉल्ट्स आर नॉट अवेलेबल टू मेक इट एब्सॉर्बेबल इन द या टू मेक इट सॉल्युबल इन द बाइल. I again repeat, कोलेस्ट्रॉल स्टोन्स की पैथोजेनेसिस में आपने क्या चीज याद रखनी है कि कोलेस्ट्रॉल स्टोन्स की पैथोजेनेसिस में बेसिक फैक्टर इज द कोलेस्ट्रॉल. और ये कोलेस्ट्रॉल क्या करता है? ये कोलेस्ट्रॉल ये करता है कि जैसे जैसे कि इसकी क्वांटिटी बहुत ज्यादा हो जाती है और जाहिर है बॉडी की एक लिमिटेड कैपेसिटी है जो बाइल सॉल्ट्स बना सकता है, द इनफ बाइल सॉल्ट्स आर नॉट अवेलेबल टू मेक इट सॉल्युबल इन द बाइल. As a result, there is lot of cholesterol. और जब ये बहुत सारा कोलेस्ट्रॉल होगा और इसको यहाँ और the bile salts are not available to make it soluble, there is cholesterol nucleation. Cholesterol nucleation क्या है कि ये precipitate हो जाएगा, they will combine with each other and form cholesterol stones. Okay, and if we look at the pathogenesis of pigmented stones, what is going to happen? बैक्टीरिया कौन से होते हैं? बेसिकली ये ई. coli होंगे, एंटेरोकोकस होंगे, क्लेब्सिला होगा. What they do is they secrete beta glucuronidase. ये जो beta glucuronidase basically ये एक चीज ये this we can ignore it. This is very less likely to cause gallstones. But what this beta glucuronidase does is that it causes the combination of bilirubin with the calcium. Once these two things combine, They form calcium bilirubinate, and if we remember that what was the chemical composition of pigmented stone, it was calcium bilirubinate and formed pigmented stones. ठीक है, अब आप ये इमेजिन करें जब पिगमेंटेड स्टोन बन जाएगा गॉल ब्लैडर में, तो वो खुद it will itself lead to the stasis of bile, and once there is stasis of bile, there is more chance to get stones. Okay, so these are basically the cholesterol stones. Okay, mechanical manipulation and laparoscopic cholecystectomy has caused the fragmentation of several cholesterol stones. ठीक है, इसका size मैंने आपको बताया कितना बड़ा size होता है, like the bird egg size, like the size of the olives, but they are usually fragmented either in the process of laparoscopic removal or they will compress each other and become fragmented. ठीक है, अच्छा मैंने किया था कि तीन तरह की कॉम्पोजिशन के हिसाब से द गॉलस्टोन्स आर डिवाइडेड इनटू थ्री टाइप्स, मिक्स, कोलेस्ट्रॉल एंड पिगमेंटेड. ठीक है, बट इन द मोस्ट आउट ऑफ दिस द मोस्ट कॉमन इज द मिक्स्ड टाइप. इसमें कुछ ना कुछ कैल्शियम होता है. इफ यू लुक एट इट, देयर इज स्लाइट ब्राउन कलर. So this brown, there is slight black color. This black color is basically the bile pigments. ठीक है, as a result of coexistent chronic cystitis. Okay, this is basically ये आपको फोटो माइक्रोग्राफ्स अगेन जो मैं हर लेक्चर में अभी तक कहती रही हूँ कि सारी रॉबिन से होती हैं. दे कैन बी आस्क्ड इन हॉस्पिटल. ठीक है, सो यू नीड टू मेमोराइज. अब ये सेल्फ एक्सप्लेनेटरी है. पीछे अगर मुझे इस फिगर को डिस्क्राइब करना हो तो मैं कहूंगी दिस इज एन ओपन अप गॉल ब्लैडर व्हिच इज प्रोबब्ली रिमूव्ड फ्रॉम द बॉडी एंड हैज दिस pigment stones. Several faceted black stones are present in otherwise unremarkable gall bladder from patient with mechanical mitral valve prosthesis leading to ठीक है, basically इसमें hemolysis हो रहा था. जब भी hemolysis होता है, either it is because of hemolytic anemia or because of any valve, it can lead to the development of pigment stones. ठीक है, तो जब OSCE में questions आते हैं से अगर आपके पास ये आएगा तो वो they can ask you कि what do you think, which type of the stone is this? You can write it, this is a cholesterol stone, or this may be a mixed stone, and then they can ask about the pathogenesis, that what are the risk factors for the cholesterol stones. Yeah, what are the conditions which can predispose to the development of the cholesterol stone? Then the second question could be like this: okay, what are the possible consequences? The possible consequences are chronic cholecystitis, or even in rare cases to the gallbladder carcinoma. So again, the pigment stones. This is a very nice, very clear picture. This can be very easily asked in OSCE. That okay, this is, and please keep it in mind that gallstones, the gallstone problem is very common. This can be very well asked in the OSCE, and they are justified in asking it because this is a pretty common problem. You need to understand it. And so this can come with okay, like what do you think, which type of stones are this, what are the possible risk factors, what are the possible complications if one is having gallstones, cholecystitis, etc. So this can be very well asked. Now what are the different tests which we can do? We will be doing liver function tests. ठीक है, अभी मैं आपको बताती हूँ liver function test क्यों करेंगे. We can do amylase. I'll discuss why. Ultrasound and CT scan. Okay, so if I ask, and I used to ask this question when I take lectures in the classroom, that why we don't do x-rays. Okay, so why we don't do x-rays to diagnose gallstones? We do not do x-rays to diagnose gallstones because the ये याद रखिए कि जो cholesterol stones हैं और the mixed stones which predominantly have a cholesterol component, they usually are radiolucent. ठीक है, वो radiolucent होते हैं, वो एक्सरे पे पिक नहीं होते. Okay, I again repeat, okay, always keep it in mind that to diagnose gallstones we don't use x-rays. Why we don't use x-rays? Because the pure cholesterol stones or the mixed gallstones which predominantly have a cholesterol component are usually radiolucent. Although the pigment stones are radio opaque, but the cholesterol the stones or mixed stones with predominantly cholesterol component are usually radiolucent. They are not picked up on x-rays. So if x-ray is done and the gallstone is visible, it means most likely this is a pigmentary stone, because the calcium bilirubinate will the precipitates of the calcium bilirubinate are usually visible at x-ray. Otherwise, we do ultrasound. Ultrasound is again easily available, cheaper. You don't have a long waiting queue. X-ray, ultrasound, they can very well picked up on ultrasound. And why we do amylase? Okay, we do amylase because once there are gallstones, sometimes the patients come with the acute abdominal pain, and there is a chance that the gallstone, when the gallstones will cause an emergency, when they dislodge into the bile duct, they get impacted into the common bile duct and causes pancreatitis. जब ये pancreatitis करेगा तो there are raised level of amylase, which is a pancreatic enzyme. So in those cases, amylase is done to rule out pancreatitis, and this is a complication of gallstones, that gallstones can lead to pancreatitis. I again repeat that how gallstones will lead to pancreatitis: when a stone which is formed in the gallbladder dislodge from the gallbladder, get impacted in the common bile duct, and in the common bile duct they causes obstruction. In the common bile duct they causes obstruction, lead to the back pressure, and that back pressure can lead to pancreatitis. And when there is pancreatitis, amylase is the one of the earliest enzymes whose levels are increased in the serum, and they can be picked up over here. Liver function test. Okay, again I would love this would be the lecture. I have asked आपको liver function test में क्या मिलेगा? A liver function test is LFTs. LFTs में हमारे पास क्या चीजें हो रही थी? हमारे पास bilirubin हो रहा था, ठीक है, और उसके अलावा हम bilirubin के अलावा कर रहे थे transaminases, that is AST and ALT, and the third thing was alkaline phosphatase and beta and glutamyl transaminase. तो हमने वहां पे जब हमने कोलिस्टेसिस भी किया था, मैंने कोलिस्टेसिस किया था, कोलिस्टेसिस में आपको क्या बताया था? कोलिस्टेसिस क्या है? इट इज बेसिकली the stasis of bile in the liver, and when it happens either there is something gone wrong with the intrahepatic bile ducts or extrahepatic bile ducts. अगर gallstone obstruction करें तो ये क्या होगी? Extrahepatic biliary tree की obstruction होगी. Okay, so if you remember the common causes of extrahepatic biliary tree obstruction, the reasons were gallstones, pancreatic carcinoma, and the carcinoma of bile duct itself. Okay, so and post-surgical stenosis. So ये चार causes मैंने जब last lecture में cholecystitis repeat किया था, even that point I emphasize that you should know at least the 4 causes of extrahepatic biliary tree obstruction. The one is the gallstone, the topmost, pancreatic carcinoma, carcinoma of the bile duct or ampulla itself, and fourth one was the post-surgical stenosis. तो liver function test में हमें क्या चीज रेज मिलेगी? हमें obstructive picture मिलेगी. Obstructive picture का मतलब ये है कि basically conjugated hyperbilirubinemia होगा, और along with some unconjugated hyperbilirubinemia, and what else is there? There are rising level of alkaline phosphatase and gamma glutarate transferase. Okay, so these all things are interconnected, which need to be revisited again and again. Now, what are the clinical features? As I said that 80% of the gallstones remain silent, and once the pain is there, the pain can be colicky or constant. Although it is called biliary colic, but most of the time it is a constant pain. Colicky pain क्या होता है कि जो आता है खत्म हो जाता है. Colicky pain means like the colics of intestine, जैसे intestinal peristalsis होती है, खत्म हो जाती है. So biliary, although it is called biliary colic, but it is not colic. It is usually a constant pain, but definitely it can be colicky. अब complications क्या होती है? ठीक है, और मैंने आपको बताया कि gallstones, please keep it in mind. Although there is a single lecture for it, definitely we cannot have too many lectures of everything. But the gallstone is a common pathology. You need to know each and everything of the gallstone and cholecystitis. Gallbladder carcinoma की एक लाइन के अलावा नहीं पता हो, मैं आपको बताऊंगी, कोई इशू नहीं. लेकिन gallstone की pathogenesis आनी चाहिए, risk factor आने चाहिए. अब complications क्या होती है? ठीक है, this is a pretty common problem. Exam के point of view से वही चीज important है in large majority of the cases. दो रीजन होते हैं एग्जाम में चीजें important होती है. एक वो चीज बहुत कॉमन, जैसे हम कहें कि आपको अगर आपने पूरा रेस्पिरेशन का चैप्टर पढ़ लिया, आपको टीबी नहीं आता, यू आर जस्ट आउट. ठीक है, you should give your exam in the reset. ठीक है, इसी तरह आपने पूरा लिवर का चैप्टर कर लिया, आपके हमने गॉलस्टोन आखिर में हुआ था, तो पैथोलॉजी में हमें नहीं आता. नो, गॉलस्टोन, गॉलब्लैडर पैथोलॉजी, स्टोन एंड cholecystitis are pretty common conditions. You need to go to them in details, and that should be on the tips. अब complications क्या हो सकती कॉम्प्लिकेशंस क्या हो सकती है, एम्पाइमा हो सकता है। एम्पाइमा क्या होता है, एम्पाइमा अगर एम्पाइमा जैसे मुश्किल नाम से रहा याद हो तो आपकी कह दे कि पास होती है। क्या होता है कि गॉल स्टोन में क्या होगा, गॉल स्टोन जहाँ पे होगा वहाँ पे ऑब्स्ट्रक्शन होगी, जहाँ पे ऑब्स्ट्रक्शन होगी वहाँ पे सिक्रेशंस का स्टेसिस होगा। और रूल ये है कि बॉडी में जहाँ पे भी स्टेसिस होता है that area is predisposed to the development of infections। ठीक है, एम्पाइमा होगा, एम्पाइमा की जब वो क्या है, गॉल ब्लैडर भी अंदर से एम्प्टी है ना, अब एक गुब्बारे की तरह, that is like a balloon, you keep on filling it, you keep on filling it either with the water or with the air, ultimately it's going to rupture। The same will happen with the gall bladder। gall bladder को भरते जाएंगे पस से, secretion से उसमें perforation हो जाएगी और abscess formation क्यों होगा, as I said there is obstruction, stasis will lead to the infection formation। fistula formation बन जाता है। fistula क्यों बनता है, again जब perforation होती है तो the gallbladder and the intestine develop communication with each other and that is called fistula। ठीक है, fistula की क्या चीज होती है, शायद two openings। ठीक है, इसकी एक opening gallbladder में होगी, दूसरी opening intestine में होगी। Then there is bacterial superinfection with cholangitis and sepsis। Again the reason is कि वहाँ इन्फेक्शन हो रहा है, जब वो इन्फेक्शन ऊपर असेंड करेगा तो लिवर पे जाके असेंडिंग कोलिंजाइटिस कराएगा, यानी बाइल डक्ट्स की इन्फ्लेमेशन एंड सेप्सिस। और जब वो प्रोसेस सिस्टमिक हो जाएगा देन इट इज कॉल्ड सेप्सिस। अगेन पेंक्रेटाइटिस का मैंने आपको रीजन बताया, पेंक्रेटाइटिस क्यों होगा, gallstones have accumulated in the gallbladder, they may dislodge from there, get obstructed into the cystic duct, into the bile duct, and it causes the development of to the development of pancreatitis। अब again these are the questions which are usually asked in the classrooms, that which is more dangerous, larger stones or smaller stones? Smaller stones are dangerous। Why the smaller stones are dangerous? क्योंकि large stone है वो तो gallbladder में पड़ा रहेगा, अगर बहुत करेगा वो एम्पाइमा करेगा, पेशेंट को पेन होगा, फीवर होगा, वो क्लिनिकली पिक हो जाएगा। लेकिन स्मॉल स्टोन है, स्मॉल स्टोन वहां से डिसलॉज करेंगे जाके, दे वेरी साइलेंटली ब्लॉक द कॉमन बाइल डक्ट, कॉमन बाइल डक्ट को ब्लॉक करेंगे, बैक प्रेशर होगा ऑन द पेंक्रियास, the enzymes of pancreas are activated inside the pancreas and it lead to the development of pancreatitis, which is a real time emergency। So that is why the small stones are more dangerous, because they can cause pancreatitis। Okay, so inflammation is the inflammation की spelling गलत है, inflammation is the of की spelling गलत है, cholecystitis is inflammation of the gallbladder। There are different type of cholecystitis, acute, chronic, acute superimposed and chronic, always associated with gallstones। वो चीजें याद रखनी है। Cholecystitis is almost always associated with the gallstones। Gallbladder carcinoma, which is adenocarcinoma, almost always associated with gallstones। So basically, the root of problem is the gallstones। Okay, I again repeat, ये point भूलना नहीं है, याद रखना है। Cholecystitis almost always associated with gallstones। Gallbladder carcinoma almost always associated with gallstones। So basically, the root of problem is gallstones। That is why in the beginning I said that gallbladder, that in the gallbladder pathology, the three pathologies which we will be discussing, that is gallstone, cholecystitis, and gallbladder carcinoma, they are all interrelated with each other। Okay, so acute cholecystitis. Acute cholecystitis itself is acute calculus cholecystitis। Calculi means stone. Calculus is singular and calculi is plural. So calculus is stone। So again the figure is very evident, that is 90%। ठीक है, acute cholecystitis 90% जो है, it is associated with the presence of stones, and it is only a very small percentage which is acalculus, that is which develop in the absence of the gallstones। Acute acalculous cholecystitis usually is ischemic। ठीक है, कब होता है कि जब यहाँ पे artery, cystic artery which is supplying the gallbladder is affected। ठीक है, इसका cause ischemia होता है। क्यों ischemia होता है कि बॉडी में कुछ arteries हैं जो end arteries हैं। ठीक है, हर आर्टरी की ब्रांचेस होती है, बहुत सारी majority of the cases what happens in the body, that the artery has branches, and once the one branch is obstructed, they develop collaterals and the organ get blood supply from another side. So usually there is no problem. But there are a few sites in the body where there are end arteries, and the cystic artery is also an example of this. So what is going to happen is, okay, there is ischemia, and as a result of ischemia, the cholecystitis develops. So the acalculous cholecystitis, or the very small percentage of the acute cholecystitis which develop in the absence of the gallstones, is probably secondary to ischemia. अब ये किस setting में होता है? Post operative, after major surgeries, जब body की generally blood supply organs में कम हो रही होती है, severe trauma, severe burn, sepsis, immunosuppression and diabetes mellitus. ठीक है, diabetes में usually जो gangrene feet वगैरह होते हैं वो भी इसीलिए होते हैं क्योंकि basically the blood supply is compromised. The same is over here. So अगर आप ये सारी causes देखें, which are the causes of acute acalculous cholecystitis, that is post surgical so basically it is an ICU setting. ठीक है, ज्यादा इसको आसान, ये 1 2 3 4 5 causes याद करने का तो एक आसान तरीका है कि बाजू का ये लिखा होता है कि acalculous cholecystitis, acalculous acute cholecystitis develop in ICU setting. ICU setting का मतलब है या तो severe trauma होगा, burn होगा, sepsis होगा, सिवियर किस्म की इम्यूनोसप्रेशन होगी जिसमें बॉडी की जनरली ब्लड सप्लाई कम हो रही है, और आइदर इट इज पोस्ट सर्जिकल। और डायबिटीज मेलाइटिस में इसलिए याद रहेगा कि डायबिटीज मेलाइटिस में आइदर डायबिटीज इज कॉजिंग आई इश्यूज, it is causing gangrenous feet, or is because the blood supply is compromised. So basically this is rare, लेकिन again it is important, so you need to keep it in mind. कोलिसिस्टाइटिस की मॉर्फोलॉजी कैसी होती है? अब हमने इसकी कॉम्प्लिकेशन की थी कि उसमें एम्पाइमा होता है और गैंग्रीन होता है। तो बेसिकली इसकी मॉर्फोलॉजी पे आपको क्या मिलेगा? एक्यूट कोलिसिस्टाइटिस में आपको एक्यूट इन्फ्लेमेटरी सेल्स मिलेंगे। अगर एम्पाइमा हो गए तो वहां पे आपको बहुत सारे न्यूट्रोफिल्स मिलेंगे। गैंग्रीन हो गया तो आपको गॉल ब्लैडर में नेक्रोसिस मिलेगी। राइट अपर क्वाड्रेंट पेन होता है, गैस्ट्रिक पेन होता है, fever, sweating, or this all can develop if the infection is developing. They may or may not be joined this. It can lead to acute surgical emergency or mild symptoms resolved without medical. Acute surgical emergency तभी होगी when it is leading to pancreatitis. Acute calculus जो है वो sudden होता है, early diagnosis होती है। अगेन उसका रीजन सेम है क्योंकि वो पैंक्राइटिस करता है, सो इट इज इजीली पिक्ड। एक्यूट कैलकुलस जो है वो इंसिडियस होता है, ऑब्सक्योर्ड। द रीजन क्योंकि पेशेंट इतना सिक होता है कि आप ये सोच नहीं रहे होते कि अच्छा इसको गॉल ब्लैडर, इसको कोलिसिस्टाइटिस भी हो रहा होगा। इसलिए कहा कि आईसीयू सेटिंग में जब पेशेंट डिटीरिएट हो रहे होते हैं तो वहाँ एक जो चीज सोचने की होती है, दैट इज आल्सो एक्यूट कैलकुलस कोलिसिस्टाइटिस। Chronic cholecystitis almost always associated with stone. Okay, so cholecystitis के लिए मैंने आपको just generally ये जुमला बताया था कि almost always associated with stone. Supersaturation of bile होती है both with the chronic inflammation and stone formation. Microorganism usually E. coli होता है, symptomatic after long standing and mild inflammation in the presence of gallstones. So chronic cholecystitis, अच्छा अगर आपको morphology इन सारी चीजों में किसी की morphology आनी चाहिए तो it is more important to have an idea of morphology of chronic cholecystitis. ठीक है, I again repeat कि इन सारी चीजों में अगर आपको किसी चीज की morphology आनी चाहिए तो morphology पे लिख के बेशक अपने पास point कर लें कि you should know at least 1 to 2 points of chronic cholecystitis. ठीक है, कोई मुश्किल नहीं है, मैं आपको बताती हूँ। देयर इज, जब भी हम कहते हैं कोई चीज क्रॉनिक हो रही है, इन्फ्लेमेशन तो बिल्कुल जब आपने जनरल पैथोलॉजी की थी उसमें किया था कि इन्फ्लेमेशन क्रॉनिक हो रही है। जब इन्फ्लेमेशन क्रॉनिक हो रही होती है वहां पे क्या होता है? फाइब्रोसिस। ठीक है, यही होता है ना कि तो इन्फ्लेमेशन सही हो जाती है, अगर वो सही नहीं होती तो इट कैन लीड टू फाइब्रोसिस। तो आप क्या लिख देंगे? सब एपिथेलियल सबसेरोजल फाइब्रोसिस होता है। लिम्फोसाइट्स होते हैं, आरए साइनसिस, रॉकेट्सी, एस्कॉफ साइनसिस बनते हैं। ये नॉर्मल हिस्टोलॉजिकल फीचर है जो आपने गॉल ब्लैडर में पढ़ा होगा। ये कब होता है? कि जब इंट्राल्यूमिनल प्रेशर इंक्रीज होता है तो क्या होता है कि जो एपिथेलियम होती है वो डिस्प्लेस हो जाती है इनटू द वॉल व्हिच इज कॉल्ड आरए साइनसिस। पोर्सलिन गॉल ब्लैडर में थिक कैल्सिफिकेशन हो जाती है ऑफ द गॉल ब्लैडर वॉल। xanthogranulomatosis हो सकता है when there is lot of histiocytes, और hydrops of gallbladder होता है when the gallbladder wall become very thin. इस मॉर्फोलॉजी में आपको क्या चीज याद रखने की है? ऑफ द chronic cholecystitis, सब एपिथेलियल सबसेरोजल फाइब्रोसिस, सब एपिथेलियल सबसेरोजल ना भी रहे तो ये करते हैं कि गॉल ब्लैडर वॉल की फाइब्रोसिस हो जाती है, मोनोन्यूक्लियर सेल यानी लिम्फोसाइट्स की इन्फिल्ट्रेशन होती है। न्यूट्रोफिल की क्यों नहीं होगी? इसलिए नहीं होगी क्योंकि न्यूट्रोफिल की इन्फ्लेमेशन होती है यूजुअली एक्यूट इन्फ्लेमेशन। डेवलपमेंट ऑफ आरए साइनसेस है। आरए साइनस क्या होता है? इफ वी लुक ओवर हियर, दिस इज अ गॉल ब्लैडर व्हिच इज aligned with tall columnar epithelium। और ये जब tall column जब यहाँ पे प्रेशर ल्यूमन में इंक्रीज होता है तो ये एपिथेलियम डाउनवर्ड डिस्प्लेस हो जाती है, और ये जो एपिथेलियम डाउनवर्ड डिस्प्लेस होती है जैसे यहाँ पे ये बड़ा सा आरए साइनस है। So what RA or Rockefeller of sinuses? It is basically the displacement of epithelium into the muscle walls. ठीक है, chronic cholecystitis with RA sinuses, the gallbladder mucosa is infected by the inflammatory cells. Outpouching of the mucosa through the wall form RA sinuses. ठीक है, यहाँ पे लाइनिंग है, यहाँ पे स्टोन आ गया, प्रेशर पड़ेगा, एपिथेलियम अंदर की तरफ डिस्प्लेस हो जाएगी, एंड दिस डिस्प्लेसमेंट ऑफ एपिथेलियम फॉर्म आरए साइनसेस। ठीक है, तो क्रॉनिक कोलिसिस्टाइटिस में मॉर्फोलॉजी में जो चीजें याद रखी, देयर इज वॉल ऑफ देयर इज फाइब्रोसिस ऑफ द वॉल ऑफ द गॉल ब्लैडर, डेवलपमेंट ऑफ द आरए साइनसेस एंड इन्फिल्ट्रेशन ऑफ द लिम्फोसाइट्स। ठीक है, ये 3 पॉइंट भी मॉर्फोलॉजी में याद रख ले तो बहुत है। पोर्सिलीन, और ये क्योंकि फैंसी टर्म्स हैं, समटाइम दे आर आस्क्ड, पोर्सिलीन का मतलब है वहां बहुत सारी कैल्सिफिकेशन हो जाती है, देयर इज मोर चांस ऑफ डेवलपिंग गॉल ब्लैडर कार्सिनोमा। और हाइड्रॉप्स का मतलब है जैसे पानी भर जाता है, चीज डिस्टेंड होती जाती है, तो हाइड्रॉप्स, हाइड्रो मींस वाटर, सो इट कीप्स ऑन डिस्टेंडिंग एंड वॉल बिकम वेरी पेपरी थिक। ठीक है, ये क्योंकि बोल्ड में टर्म्स दी हुई थी उसके अंदर मॉर्फोलॉजी में, इसलिए मैंने यहाँ पे मेंशन कर दी थी। लेकिन बेसिकली क्रॉनिक कोलिसिस्टाइटिस में क्या चीज याद रखनी है? फाइब्रोसिस, मोनोन्यूक्लियर सेल इन्फिल्ट्रेशन एंड डेवलपमेंट ऑफ आरए साइनसेस। मॉर्फोलॉजी सिर्फ आपको क्रॉनिक की भी आती है, दैट इज एनफ, देयर इज नो नीड टू that affect you. So chronic cholecystitis, we have 5 minutes more. Recurrent attacks of chronic colicky, epigastric or right upper rheumatoid, nausea, vomiting, or intolerance for fatty food होती है, because now the enough bile salts will not be available. Diagnosis of acute and chronic cholecystitis is important because of the following complications. Complications of gallstones आपकी टिप पे होनी चाहिए। cholecystitis के complications इसमें कुछ ऐसा मुश्किल नहीं है, एक दफा समझ लेंगे तो यू कैन राइट इट। बैक्टीरियल इन्फेक्शन होता है, क्यों होता है? स्टेसिस की वजह से होगा। फिर ये बैक्टीरियल इन्फेक्शन इवन लिवर में भी असेंड करता है, इसको असेंडिंग कोलिंजाइटिस कहते हैं। परफोरेशन, एब्सेस हो सकता है, रप्चर हो सकता है, जाहिर है जब गॉल ब्लैडर रप्चर होगा तो पेरिटोनाइटिस कराएगा। कोलिसिस्टो एंटेरिक फिस्टुला होता है। कोलिसिस्टो एंटेरिक फिस्टुला क्या है कि गॉल ब्लैडर और स्मॉल इंटेस्टाइन में फिस्टुला बन गया, इसकी कॉम्प्लिकेशन हो सकती है एंट्री ऑफ एयर बैक्टीरिया गॉलस्टोन इलियस, यानी स्मॉल इंटेस्टाइन में अगर आपको गॉलस्टोन मिल रहा है तो इसका मतलब है कि देयर इज अ फिस्टुला फॉर्मेशन बिटवीन द गॉल ब्लैडर एंड इंटेस्टाइन। Aggravation of the pre-existing medical illness with the cardiac, pulmonary, renal or liver decompensation, सारे ये सब चीजें affect हो सकती हैं। Tumors, any type of tumor related to fibrous nerve, blood vessels, gland, यहाँ पे कौन सी लाइनिंग होती है गॉल ब्लैडर में? इज द टॉल कोलम्नर लाइनिंग। टॉल कोलम्नर के लाइनिंग को हम क्या कहते हैं? एडिनोमा। ठीक है, तो एडिनोमा हो सकता है यहाँ पे, ब्लड वेसल्स का बिनाइन ट्यूमर हो सकता है, इमेंजोमा जैसे हमने लिवर में किया था, नर्व का बिनाइन ट्यूमर हो सकता है, एक्सेट्रा। कार्सिनोमा ऑफ द गॉल ब्लैडर, ये अब ये वाला जुमला देखिए, अप टू 90% केसेस हैव गॉलस्टोन्स। ठीक है, कोलिसिस्टाइटिस 90% ऑफ द केसेस एसोसिएटेड विद गॉलस्टोन्स। गॉल ब्लैडर कार्सिनोमा 90% ऑफ द केसेस एसोसिएटेड विद gallstone। women में कॉमन होता है, क्यों women में कॉमन होता है? वेरी ऑब्वियस रीजन, बिकॉज द gallstones are far more common in women than men, so that is why the gallbladder carcinoma is far more common in women than men। ओल्ड एज में होता है, मोस्टली एडिनोकार्सिनोमा होगा। एडिनोकार्सिनोमा क्यों होगा? स्क्वेमस सेल कार्सिनोमा क्यों नहीं होगा? क्योंकि टॉल गॉल ब्लैडर की लाइनिंग टॉल कोलम्नर है, और टॉल कोलम्नर से हमें पता है जो मैलिग्नेंट एपिथेलियल ट्यूमर डेवलप होता है, दैट इज कॉल्ड एडिनोकार्सिनोमा। Usually doesn't have a good prognosis. It was irresectable by the time it is diagnosis. Parasitic disease is also involved in the endemic areas. Okay, so basically this is open up gallbladder. This is a tumor sitting here. This is the photomicrograph of the same. You can see the formation of glands. That is why it is. This is a glandular space with the lumen over here. The glandular lining. This is adenocarcinoma. ठीक है, एडिनोकार्सिनोमा गॉल ब्लैडर रेयर होता है, ये पूछने का आपसे चांस बहुत कम है, लेकिन जो चीजें इसके बारे में आपको याद हो यही है कि गॉल ब्लैडर में कौन सा कार्सिनोमा होता है? एडिनोकार्सिनोमा। विमेन में कॉमन होता है, क्यों कॉमन होता है? क्योंकि गॉल ब्लैडर के साथ, गॉल ब्लैडर स्टोन के साथ एसोसिएटेड है, which are far more common in women. So the take-home points are that the cholecystitis is associated with these four. Stone formation depends on the relative concentrations of cholesterol, bile salts, and phosphorus. Okay, this is pretty evident.